So, what we have here are selected images from a post-contrast axial CT scan of the neck. There are a few key abnormalities I'm noticing straight away. In the submental region, there's a well-defined ovoid subcentimeter calcific lesion just off the midline. When we move to the right submandibular region, I can see several low attenuation areas with peripheral high attenuation, which is probably representing enhancement. This area is also showing that the right submandibular gland is enlarged, and there's stranding of the surrounding fat, classic signs of infection and inflammation. At least one rounded low attenuation area is present within the right submandibular gland itself, and I can clearly see two ovoid calcific lesions in this region. At least one of these calcific lesions is within the gland itself. Additionally, several small low attenuation areas are evident in the left submandibular gland as well, though there's no significant fat stranding on that side. So, overall, this is most in keeping with obstructing calculi in the distal submandibular ducts bilaterally, leading to abscess formation on the right side and likely sialectasis in both glands. Given these findings, I would immediately discuss this with the NT surgical team as an emergency, due to the risk of serious complications such as airway compromise from the abscess spreading into other neck spaces. There's always a significant mortality risk with submandibular space abscesses, especially with the degree of infection and obstruction shown here. To sum it up, this looks like a right submandibular space abscess in an adult male patient, with obstructing submandibular duct calculi bilaterally. The abscess formation and likely coexisting sialectasis are probably all due to these obstructions, leading to infection and abscess formation. Before I finish, let me leave you with this. Submandibular abscesses can be tricky, especially when the infection spreads from dental infections or nearby regions. It's a good reminder to always scrutinize the adjacent anatomy, like the sinuses, air cells, orbits, and even chest imaging if you're considering hematogenous spread. Imaging is the key in these cases, and contrast-enhanced CT is the go-to modality for investigating suspected abscesses in the submandibular space, as it gives us a clear picture of the infection's extent and any obstructions, just like in this case. If you found this breakdown helpful, don't forget to hit subscribe to Radiology Made Easy, and drop any questions or comments you might have below. Let's keep learning together.